As a project coordinator for Breaking the Cycle, I am bringing together the stakeholders of Chatham County when it comes to law enforcement, substance abuse providers, mental health providers, as you know, here at the Sheriff's Office to help reduce the booking rates of people with mental health issues and substance abuse, as well as help reduce recidivism with people with mental health and substance abuse in Chatham County. And bringing everybody together. I'm also working on gathering data to be able to make policy changes of how we have been doing things so that we can move forward in a way that helps make our mission, but also just for the benefit of everybody in the community, especially with mental health and substance abuse. We're here at the Chatham County BHCC. This is the Intercept 0 and 1. This is our law enforcement entrance for our 1013s and any assessments that the law enforcement may need. This is their private entrance.
Once law enforcement bring the patient to us and they come through the door into the hallway into this space, this is our transportation area receiving room. Here we would begin the intake process and take the patient, the individual, from law enforcement. We have an open area. If the individual is calm and compliant, we can actually take care of the concerns here. If not, we have three specific rooms. One of these is actually an exam room, so we can do some triage if the individual needs that immediately. And then we also have two interview rooms and consult rooms. So these are spaces where we can do specific intake for the individuals who are coming in. Here at this place, we also have our own security that comes up and greets law enforcement. Our security hands off, and we actually go through a security protocol ourselves, including doing a search for any hidden weapons, and we have a magnetic wand that we use to search for those things. Individuals here also have their own bathroom facility and a shower. The individuals will change into a uniform here, so we have the ability to take good care of them and make sure they're not taking anything onto the unit that we don't want them to.
This is the intake booking area. Inmates will come in, or individuals, I should say, come in here by the arresting officer. There's a transport door in here. There will be a nurse here taking vitals and intake process. This is more of a medical clearance process. There is some suicide questions in the intake process, but it's really to make sure that they're medically cleared to come in. If they were not medically cleared, they would be taken out by the arresting officer. This is where the arresting officer would be doing his booking process, as well as the nurses are here doing their intake process. Once the nurse clears them medically to be booked, all of their property will be taken. There will be shoes, any miscellaneous type of property will be done here. They're brought into this screen here. And this is where they do an X-ray machine to see if the individual has any type of weapons or anything on them. Once they are done with this process here, they are moved over to the actual IDing and booking process. Now, the whole process is about 4 hours. Well, they have up to 4 hours to book a person and have their nurse's intake. Now, that's not the medical clearance that is with the nurse. They have 4 hours to get the person booked in to then do the nurse's intake, and we will move over into that area. This is the nurse's intake area where an individual being booked is go through an intake process. Will be a medical and psychological screening. The individual normally is sitting over here. We'll have the nurse here, and they'll be going through all of the screening process. This is where the nurse will assess if the person needs a mental health referral, which will then be sent to the mental health providers, Correct Health, that we have. Our mental health provider is Correct Health, and the referral process through the booking is sent to the mental health offices, and every morning they go through and see their referrals. The referral process is emergent, urgent, routine, and non-mental health. And those are tagged to time frames that a person needs to be seen by a mental health provider. Correct Health, the mental health providers, utilize the database system of Centricity to do their screening and to do all their electronic records. So I'm going to log in and bring you through the mental health screening that the nurses do at the intake. So this is taken during the booking process. And the nurses will go in, and then the nurses intake overview, and there is a series of questions that the nurse will ask an individual as they're being booking. And once they're done with that, that is when the referral would be getting made, whether or not they would be a mental health referral or not. We are here in one of the housing units. As you can see here, we have a module in the middle, and around in each 4 different types of housing units through each one of these doors. We're going into the medical unit of the jail right now. The medical unit is again contracted by Correct Health. This is more of the physical medical unit. Mental health services, when it comes to individual counseling, is done in the ranges and in the housing units. However, anybody that has any type of psychiatric medical needs are also housed here in the medical unit. We're here at the discharging process of the jail. When an inmate is being discharged, they're brought back into the booking area where they will receive their belongings and get changed back into their street clothes. And then they are escorted by an officer out to the front area. When an inmate is being discharged, they are given a green dot card or whatever is left on their books, and they come to the cashier, as well as if they need a bus pass, they are given a bus pass. And then through here, there is a telephone that they are able to utilize to see if they can organize a ride, if possible. I see everybody 100% on board here at the county jail, the sheriff and the command staff, and then as well as in the community. So I have judges that we're working with, we have lawyers, we have all the mental health and substance abuse providers here in the community. Everybody is just coming together. We meet twice every other month as a big collaborative group, and then we have breakout groups. We have clinical care group, and we have our data and evaluation group, and we meet every other month as well. And everyone's coming on board and doing what they can to make sure that in Chatham County, people with mental health issues and substance abuse are being taken care of and not getting put into incarceration into the justice system.